Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions in head and neck anatomy. I will continue solving multiple choice questions in head and neck anatomy in the coming weeks. And I am the author of anatomy test paper containing around 1800 multiple choice questions. I will add that in my description bar. I will also follow the textbooks when I write the question and in the coming days, and I will also add the link of the textbooks in the description bar of my video. So if you have any time, please collect those books if you can. Let's solve the questions. Question number 6. A 23-year-old batsman was hit by a cricket ball while playing the delivery of a fast bowler. Cricket is very popular in India, also in Pakistan and Bangladesh. So this happens very frequently. An MRI of his head showed a fracture of the jugular foramen. Which of the following cranial nerve exits through the jugular foramen? Mandibular nerve, facial nerve, vestibulocochlear nerve, abducent nerve, glossopharyngeal nerve. Answer should be glossopharyngeal nerve, along with other nerves. But here, among these, this is the choice. Mandibular nerve should go through the foramen open. Facial nerve should come out through the stylomasted foramen. Vestibulocochlear nerve should go through the internal acoustic meatus. Abducent nerve, the passage is the superior orbital fissure. So answer should be glossopharyngeal nerve. Okay. So question number 7. All of the following structure passes through the jugular foramen with one exception. The exception is what? The jugular foramen contains the cranial nerve 9, 10, 11 and inferior petrosal sinus, but not the middle meningeal artery. Middle meningeal artery passes through the foramen spinosum. So this is the exception and this is the answer. Question number 8. A 27-year-old man has received deep laceration of the neck. The emergency medical officer is suspecting a possible lesion of the cervical sympathetic trunk. What could be the most probable effect of nerve injury in that patient? Nerve injury means damage to the sympathetic nerve to the head and neck or damage to the sympathetic trunk. So what will happen? Loss of taste sensation from the tongue, sensory loss of the face, Horner syndrome, blindness, diplopia. Answer should be the C, Horner syndrome. Question number 9. A 31-year-old woman was involved in a domestic violence and received a lacerated wound on her left parotid region. What could be the left-sided effect of the nerve injury to that woman? Okay, we know that facial nerve is a content, it branches inside the parotid gland. So if there is any damage to the parotid gland, most likely there will be facial palsy or facial paralysis. Anosmia, no, because it involves the olfactory nerve. Blindness, no, it involves the optic nerve. Mydriasis, no, it doesn't happen. There is no injury to the nerve supply to the eyeball, to the sphincter muscles. Okay, so there is no mydriasis. Diplopia is not happening because the muscles supplying the extraocular muscle are not involved. Answer should be E, facial paralysis. Okay. All of the following are characteristics of Horner syndrome with one exception. Exception is what? Exception is mydriasis. No. In Horner syndrome, there is meiosis. People constricts. People does not dilate. We'll get multiple questions from Horner syndrome in our competitive exam like USMLE or the postgraduate exam. So everyone should know the components of the Horner syndrome. A 37-year-old woman has developed a massive pituitary adenoma, acromegaly, and left sixth cranial nerve palsy. Which of the following dural venous sinus is invaded by the adenoma? So sixth nerve is a content of cavernous sinus. So our answer should be left cavernous sinus. Left cavernous sinus. Okay. Now we'll go to the question number 12. All of the following structure passes through the superorbital fissure with one exception. Exception is what? What is the exception? The oculomotor nerve, the trochlear nerve, ophthalmic nerve, the optic nerve, the abducent nerve. Answer should be what? The optic nerve. Optic nerve does not go through the superorbital fissure. We have the optic canal for optic nerve. Okay, a 45-year-old man with a history of chain smoking from his high school years has developed an apical lung cancer, also called Pharynx tumor, with involvement of the cervicothoracic ganglion, also called stellate ganglion. The patient will present with all of the following signs, with one exception. Exception is what? It is obviously the Horner syndrome. So exception should be pupillary dilation. It will not be dilated, it will be constricted. That will be meiosis, not meiosis. A 9-year-old girl was very surprised to palpate the large membranous unossified gap on the center of the cranial vault of her newborn baby brother. Obviously, it was the anterior fontanelle. The anterior fontanelle usually closes by 1 year, maybe even 6 months, maybe even 1.5 years, but never 3 years in a healthy person. So this is the best choice, 1 year. The anterior fontanelle of a newborn is located between the frontal bone and two parietal bone. Answer should be why? What is the answer? This is the answer. Frontal bone and two parietal bone forms a diamond shape anterior fontanelle. A boxer received a severe blow on his left pterion and became unconscious. After a while, he gained consciousness for a short time interval and then became comatose. Which of the following artery is related to the pterion? Okay, pterion is related to which artery? Occipital artery, posterior auricular artery, anterior division of the middle meningeal artery, internal carotid artery, maxillary artery. What is the answer? C is the answer. Number 16, C. Okay. There is the anterior division of the middle meningeal artery. All of the following bones adjoin one another at pterion. The bone actually make almost an H-shaped appearance. Multiple bones come together. Okay, with one exception. The exception is what? Frontal bone, zygomatic bone, parietal bone, sphenoid bone, and the temporal bone. Answer should be the zygomatic bone. Okay. A medical student discovered a palpable subcutaneous lymph node above the medial one-third of the clavicle of a 67-year-old man. The attending physician diagnosed a possible metastatic cancer at the left venous angle. Which of the following structure opens into the left venous angle? Left venous angle is a junction between the left internal jugular vein, left subclavian vein. This is the site for opening of the thoracic duct. Okay, a 27-year-old man traveling through the northern Alaska can see the beautiful blue sky with scattered white clouds, unending icy ocean, but is unable to close his right eye, cannot blow his right cheek, and has difficulty to wrinkle the right side of his forehead. Which of the following nerve affected on his right side? Facial nerve, ophthalmic nerve, he can see optic nerve. So optic nerve, he can see ophthalmic nerve. So his sensation over the skin, over the forehead is okay. Maxillary nerve, mandibular nerve. So sensory innervation from the face is okay. Motor innervation is not okay. Which nerve supplies the muscles of facial expression? Ophthalmic nerve does not, it is a sensory nerve. Optic nerve is a sensory nerve. So, which nerve affected on the right side? Okay, so what is that? The person is exposed to cold, so he might develop Bell's palsy. There is the lower motor neuron lesion of the facial nerve. So our answer should be facial nerve. Okay. The chordae tympani nerve carries taste sensation from which of the following? Chordae tympani is a branch of the facial nerve. It carries taste sensation from the, okay, so let me try here. It carries taste sensation from soft palate, no. Pharynx, no. Anterior two-thirds of the tongue except velvet papillae. Velvet papillae, epiglottis. From where? That is from the anterior two-thirds of the tongue except velvet papillae. And that's all about the multiple choice question. We have 15 questions today, and I will continue multiple choice question solving with you this week and hopefully next week. And I have a book on multiple choice question, USMLE type, and a lot of them, and that is available in Amazon. I will write a link in my description bar, my book, and also the textbook I followed to write this question. So certainly, if you have any time, please look at those books from my description bar. And please share the information with your friends. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice day. Bye now.